supposed to be delivered primarily by the county governments. That's why for us, we are very much, zeroing down on county governments because the promise was with those county governments. And when we see in the streets, dilapidated infrastructure, we are not seeing the promises that were made, then we get extremely, extremely frustrated. And it's not just civil society, it's the population out there. Many people feel that, county governments are not delivering on their mandates. Every time you go to county governments, the services are never there. You find that county governments mainly divert resources either to governors' homes, to county executives. It becomes a pool or a party for a few to benefit from the county government resources. But the larger population remains unserviced or, not truly getting the fruits of devolution. So we feel that, time has come for us to consider restructuring the devolution structure that we have in this country. It is our firm belief that we over-devolved. 47 is, economically unsustainable, politically not viable, and it's about time we have used the experience, 15 years of experience, to review the devolution structure that we have so that we can then put into account our experiences to make sure that we are able to do that. And as I conclude, one very clear proposal that we are making is to reduce the number of devolved units. 47 is just too much. We need to reconsider that, either halving it at most, or maybe even having a minimum of 8. So that we can have more resources dedicated to service delivery as opposed to paying 47 governors, paying 47 county assemblies, and all this, all those resources can be better channeled to provide services to the common mwananchi.
Great. Thank you very much. I think one of the things you've highlighted is after 15 years, we need to come back and ask ourselves, how is it working? Now, I want to turn to another oversight agency, and this is NGEC, and ask, how would we translate this to national values? Because the ideal would be if good practice became norm and became a national value. You did a study not so long ago on national values and how counties are actually implementing that. Would you please speak to it very, very quickly?
Thank you, Jackie. Allow me to appreciate the panel. Unlike yesterday, it is a very inclusive panel. We have a 50-50 representation. As a commission, we were very concerned yesterday that out of all the speakers, we only had 2 female. That is, the first session had only Senator Muma, and I think the afternoon had only Governor Gladys Wanga. So I'd like to congratulate you today. Having said that, from National Gender and Equality Commission, of course, we are a constitutional commission established pursuant to Article 59(4) of the Constitution of Kenya. And our main mandate is to promote gender equality and to ensure freedom from discrimination. And therefore, we have worked closely with the county government because out of our 16 mandate, as you have rightly put it, one of it is to ensure that the principles of equality and inclusion is adhered to by both the national and the county government. For a decade, we conducted monitoring, and therefore we noted gaps and gains. And I would like to put my presentation into 3. I will start with the representation. In terms of representation, we have been having a progressive growth, especially in representation of female in county assemblies, where at least the basic minimum of 33.3% is met. However, there is no effort to increase the representation to 50. Therefore, we have an opportunity to do better. Also, in terms of representations of youth, progressively from 2017 to 2022, we have numbers of youth elected to county assemblies from 317 to 349 in 2022. Also, persons with disability, as Commission, we have noted that almost half the county assembly have representation of persons with disability in the assemblies. And I would like to appreciate the governor of Siaya, is one of the counties with persons with disability in their assembly. Again, another indicator is protection of the vulnerables, especially women, from harmful cultural practices such as FGM, gender-based violence. Again, there is a progress. However, the gap is that we are seeing increase of femicide. Some counties are still practicing retrogressive practices such as FGM. Therefore, we have an opportunity to do better. Thirdly, we also audited in areas of access to services, especially public participation, which is a constitutional requirement. I think that is an avenue where we could do better as a counties. There is a report that it is more or less like a token or organized participation. Therefore, going forward, we would like to see citizens having a lot of say and participation. What do we do as National Gender and Equality Commission to ensure that all these values of Article 10 is adhered to? We do a lot of collaboration with counties. We support the CECs and MCAs to train them on the values of Article 10. We support the county government to develop policies. I think over 35% of counties have policies, gender-based violence policies, PWD inclusion policies, and other policies that is relevant to inclusion. Likewise, we also train the clerks of the national assemblies to be more sensitive, especially when it comes to issues of budgeting, to ensure that the special interest group is protected. Thank you.
Thank you very much. What we are hearing is it's happening, but it could do better. One of the areas of inclusion you have highlighted is gender. But one of the most excluded is actually young women. Now, I have with me Ms. Bolo, who is the chairperson of Young Women Leaders Connect. What does it look like for young people? And what would you speak to the leaders on this panel on how best to include young people, especially young women?
Thank you so much for that. I think I'd like to start from the point on transparency and accountability that I think Senator Mbongatana spoke to. And it amazes me that every time there is a governor who has just come in, when you're in their meeting, the first thing you'll hear them say is, you know, when we came in, we didn't find structures. We are still putting up structures. And so very recently, after the 2022 election, our pain point was we cannot even ask for certain accountability because the response is then going to be, we have just finished putting up structures, so now is when we want to start working, 1, 2, 3 years down the line. And so what that does is, as young women specifically, when we want to put the governments to task, and even county assembly to task on certain things and certain issues, you can't get a response because they already have a defense mechanism of how they are going to respond to you. They also still don't have certain policies. It would come as a shock to many that up to now, we still have county assemblies that don't have a sexual harassment policy. It's only until recently that a number of them were still doing it. So as a young woman, when you're going to a member of county assembly, for example, to try and engage them on the issues on sexual harassment within your ward or within your area, how do you begin when they themselves don't even have a document that they can use in protecting you, a document that they can use when they are going into the county assembly? How do you begin that conversation? And so I think for young women, it starts from the point of dialogue. We do not have we don't have enough systems for dialogue. We don't have enough systems to even try and question the various legislators that are there. A lot of counties right now don't have working websites. Very recently, we were having a dialogue forum in one of the counties, and a young woman stood up and asked, why is it that we don't have a sexual harassment policy? And the member of county assembly in the county said, no, we have it. Go to the website and check. We actually have a lot of progressive gender bills that we are doing. You will find them on the website. But to their surprise, the website was not working. And so how do you follow up on the mechanism you have been sent to go and check on and contribute towards? I think the other issue is public participation is not, it is being done just to look like it has happened. So to talk about the structure of it, if I'm a young woman and I'm a lactating mother, it's going to be very difficult for me to get there because the environment is not suitable for young people, for young mothers. So you find that they don't have an area where they can say lactating mothers are free to sit here, or we are able to get minders for the young children. So what I'll do is I'll stay home. I will not go for that session. Then if you're maybe working, because look at most of the public participation forums are done during weekdays. So if I am working, then I'm not able to attend the public participation forum. I have to choose between making my bread or going to participate in decision making. So if we are able to incorporate civic participation, we have apps like Civic Voices that are able to tell people, these are the public participation forums that are happening, this is where it's happening, should you want to give your views, this is how you can give your views. That way, even if I'm not able to be there physically, I am able to at least follow up and see this is what people discuss and this is what has happened. And this is the areas that we can do better. I think another area is the relationship between senators and governors. A lot of times, if the senator and the governor are from the same party or from the same coalition, then very rarely will you hear oversight discussions. But if they are from different camps, then the excuse, especially from the executive, then becomes, I wanted to do A, B, C, and D, but the politics from the senator has stopped me. So again, that makes it also very difficult to question some of their gains and some of their losses, because then the issue becomes very political and moves away from what the tangible issue is. I think lastly is also to talk about the voices of young women. So when you go to, there are certain forums that we know are designated for the wazes, let me say, the traditional elders. We know women have the chamas, the jumuiya, but as a young woman, when you want to go to the chama, most of the time the women will tell you, you have your own duties as young women. Go and get your own caucuses as young women. And when you go to the areas where the youth are supposed to be socializing, then the young men will not expect you to be there because that is their space. They want to dominate. So you find that young women fall through the cracks because then they don't exactly have a particular area where they can belong, where they can, voice out what some of their issues are.
Thank you very much. I think hearing that you've talked about policy, but you've also talked about many false starts, especially in inclusion of younger person. I want to turn to you, Council Okello. You have had very good practice in terms of reform, especially at the judiciary level. Are there lessons you can share very, very quickly in a minute or so that you could share that counties can borrow in terms of how to meaningfully achieve these rights for citizens? Very quickly, sir.
Thank you very much. You'll just give me a minute before I talk about the law and the judiciary, to talk about economics. In a minute, because we are talking about socio-economic rights, which is a very developmental term. My view, am I audible? Yes. Yeah. My view is that we'll only realize socio-economic rights if we satisfy two considerations. One, we must get the conceptual and philosophical basis of rights correctly. These are not gifts. they're at the center of human dignity. And that requires a major mental shift to embrace the very citizen-centric constitution that we have and not a state-centric constitution that we had before. So there needs to be a mental shift among duty bearers on the question of right within the context of Kenya in 2025. Then the second consideration is we must get the empirical and the strategic and the financial right. That's a second precondition. And what do I mean? Socioeconomic rights plays out on the fourth schedule, which is what Khalid was talking about. Devolved units are a major agent of realizing socioeconomic rights. And a lot of jurisprudence around the Bill of Rights has also emerged through contestations around devolution. Now, if we do not complete the transfer of functions to devolved governments, that process is incomplete, it's inchoate. And the best illustration is in health and agriculture. And I'll just give you two figures and one anecdote. So if we do not complete that transfer, and we also do not sufficiently support county government financially, then we are likely to face constant trouble with respect to socioeconomic rights. But also, if we do not have corresponding accountability that is robust, then it doesn't matter how much money you give to counties. The reason why I'm saying this is if you look at health, or if you look at overall allocation of sharing revenue, it has been declining. The national budget is increasing, the equitable share of revenue is declining. It was at 17.3% in 2022. It was at 15% in 23, 14% in 24, and 14.3% in 25. So the decline of the equitable share of revenue runs opposite to the increase in the total budget from 2.1 trillion in 2022 to 2.8 trillion. That's number one. Number two, and this is where the bigger story is. So first of all, we are below the constitutional threshold. But number two, if you look at the allocation to health and agriculture, which are effectively devolved functions, if you look at the fourth schedule, and those are the socioeconomic rights arena, that is where the real story is, and we should be worried about it. If you look at that data, since 2013, I did the math here, since 2013, the total amount of money that has gone to agriculture is 851 billion. Counties have received 194 billion. National government, 657. So counties, agriculture is devolved, but they have received 23% of agriculture allocation. Health is 50-50, yet health is also largely devolved. That tells you that the incomplete nature of the transfer of functions to county government will continue to undermine the ability to realize socioeconomic rights. That's the first thing I wanted to say. Then on the judiciary transformation that you talked about, yes, this is a key institution, realization of rights. In 2011, when we came in, we had 16 high court stations in the whole country. Today, there are about 45 high court stations. We had 53 judges throughout the country. Today, we have 190 judges throughout the country. In this county, you had to go to Kisii to access a high court judge. For those who know this county, from Nyakach to Isibania, there was only one judge in Kisii. That has changed. We have judges here, we have judges in Migori, and so on and so forth. So we increased the number of judicial officers to just improve the access to justice. There are many other things that are going on which may help with inclusion and socioeconomic rights. One, if I may say very quickly, the small claims court. It was set up almost 3 years ago. As of now, it has had 294,000 cases, which says that there was suppressed demand for justice. And for me, that is a frontier for work. Number two, we have the alternative justice system mechanisms that the judiciary is rolling out, which is a very good alternative framework for resolving disputes quickly and in a cheaper manner. So very quickly, those are just two things that are happening in the judiciary that I think are key in helping realize socioeconomic rights at a very basic community level. Thank you.
Thank you very much. Ladies and gentlemen, time is not on our side, so we need to be closing the panel. But I think hearing all that, I just wanted very quickly to ask Governor Orengo, what new practice would counties then adopt that would help in realization of these rights? Very quickly, sir.
I think, first of all, let me make a general comment about some of the things that have come up, because they have been directed to counties. There should be no apology about accountability. That is a requirement of the Constitution. And Mr. Khalid, my friend, whenever you are oversighting counties, either as a government institution or a civil organization, that is provided in the Constitution. And you should not whine about it. And I want to remind Governor Mungatana that you have the tools. If I'm summoned by the Senate and I do not appear in the Senate has tools to punish any infractions to legitimate processes that are being conducted by the Senate, either as an oversight body or as a legislative body. But overall, I want to say devolution is the way forward. Whether you live in the west, the east, or south, or north, you would find that the most productive, successful countries are those who are devolved. Whether they are big or small, they could be as small as Switzerland, or as big as China, or as big as the United States of America. And what Mr. Okello has said, I think it's where the problem that we have in this country, that whereas we glorify devolution, but what we do really means that we are still not committed to it. If you take a country like the United States of America, if you take those states separately, California, New York, Illinois, they are an integral part of a bigger economy, but even on their own, they contribute greatly to the national economy and even to the world economy. So we should not have any doubts that the future is really with devolution. And in Kenya, the problem is that this national government is still not quite in tandem with the promises of this constitution, that in order to bring power to the people, in order to take resources to the people, if you look at Chapter 11, you look at Article 174, it is the mechanism that the Constitution has established for taking power to the people and to take the resources to the people. And the tragedy is today, particularly on social and economic rights, as Mrs. Kello has pointed out, the resources that should be going to the counties are mostly still with the national government. Thank you very much.
Thank you very much. Ladies and gentlemen, please help me clap for the panelists who've done a very good job in the very tight time. What I've heard them say is accountability is non-negotiable. It is good practice, it's good manners. We must be accountable. We've also agreed that the Constitution is the foundation and we must mature it, we must respect it. They've said oversight is important and the oversight organs and tools need to be applied. But we've also said for this to happen and sustainability of development, we must be innovative and inclusive. Ladies and gentlemen, my sincere apologies. This would have been the best conversation if it lasted 5 hours because we needed to ask more questions, but we all overslept because this is Homa-Bay, the home of fish. We had a little too much to eat and didn't make it too early. So thank you very much, ladies and gentlemen. You can still ask the panelists when they come back the questions you may be holding. Thank you.
All right, so let's appreciate them once more. That is a great thought-provoking conversation there by Ms. Jackie Mbogo. She is the moderator as well as Chief of Party UK Aid Reinvent Program. We've also had His Excellency Governor James Orengo, Governor Siaya County, Honorable Millie Grace Odhiambo, Member of Parliament for Suba North Constituency, Senator Honorable Danson Mungatana, Senator for Tana River County, Honorable Rehema Jaldesa, Chairperson, National Gender and Equality Commission, Mr. Hussein Hali, the CEO of Vocal Africa, as well as Counsel Duncan Okolo, Associate Director of the Kenya Judiciary Academy, and Ms. Ruth Bolo Okul, the Chairperson of the Young Women Leaders Connect. And as we always do, let's have them take a group photo for this second plenum. In the interest of time, we now move on to our side events happening in the designated breakout areas. Please check your program to see which sessions you'd like to attend. Here in the main hall, we have a session by the Digital Health Authority on the role of digitization in healthcare in promoting social equity, justice, and inclusion. If you want to be in that side event, do stay in the main hall. But a very important, something important to note, that we will convene right here in the main hall at exactly 12:30 p.m. for a high-level session with our guests.
Thank you so much, Dr. Dhuranira, and thank you to each one of you who has made time to come. So this is the Digital Health Agency. We are 1 year old, and we thought what better theme than to look back and look at the pains, the gains, and the opportunities. The video that you just watched summarizes our mandate and summarizes what we have been able to do, but also gives you a snippet of how the future looks like, given that our mandate is to really lead and steer the digital health transformation agenda in this country. With the leadership, under the leadership of our CEO, Engineer Lenayara, a very passionate human being, a very passionate technical team, an overall DHA team, and together with stakeholders, we look forward to seeing a time when there will be only one digital health record for every Kenyan. This is what we are calling the shared health record. This is what will enable us to get care wherever we are within this country, and we're even dreaming of a global shared health record when that time comes. We have been able to do quite a lot in the last 1 year. We have operationalized a saga. We like to say we were born and started running. So today we are particularly happy because we will also be launching our first strategic plan. And we are happy that you are here to help us say, wow, it's been 1 year, but we can see what we have done. We also have been able to work with several, we like to call them clients, the first one being the Social Health Authority. Because of the work that we've done with them, we have about approximately half of the Kenyans already registered on SHA. We are counting the numbers. We are at 25 million heading to 26 million. And we are also counting how many have paid their premiums to enable us to enable them access the Social Health Insurance Fund, where the services are mainly level 4, 5, and 6. We've also been working with the counties to digitalize the health facilities because we believe that is the foundation. When our health facilities are digitalized, a lot of these other things that we dream about will become a reality. We have already gone to several counties. We are at we've activated in about 13 counties. We are already training healthcare workers from more than 19 counties. We are heading to 2021 thereabouts. And we have over 600 health facilities that are currently live on Taifa Care Hospital Management Information System. The bit about digitalizing health facilities did not start with DHA. We have been doing this, but doing it in the private sector, doing it in the HIV program if it's within the public sector. But now we want to scale that up and do it in all our health facilities. As DHA, we dream of virtual health facilities. facilities in the cloud. That is what we like to talk about. We dream of telemedicine. We dream of predictive kind of analysis that enables precision medicine. We have lots of dreams, but we cannot dream alone, and we cannot achieve those dreams without each one of us here. So this particular session, this particular side event will be helping us to look back at what we did well, what we could have done better, and then we are able to look at the front, at the future, and determine what needs to be done. I look forward to the conversations that we are going to have, and I welcome each one of you to, be part of this session in some way. So with that, I will hand over to the MC back. Karibuni, asanteni.
Thank you, Joyce. So we enter the next part of this session. We want to do a brief panel discussion. With me are panelists who are coming to join this discussion, and I'll introduce them in no order. We do a brief panel discussion, less than 30 minutes, so that we go to the next, so that you're able to understand essentially the Digital Health Agency and its mandate and work they do. So in no particular order, allow me to welcome Dr. Gregory Ganda. Dr. Ganda is a CEC member for Health, Kisumu County. Can we clap for him? It shall be followed by Dr. Angeline Chirchir, the CEC member for Health from Nandi County. Can we clap for her? Thank you. The next shall be Dr. Brian Lishenga. Dr. Brian Lishenga chairs the Rural Private Hospital Association. Welcome, Dr. Lishenga. Dr. Kariuki David is the CEO of the Kenya Medical Practitioners and Dentists Council. Dr. Kariuki comes to represent regulators. Also a round of applause for him. We were expecting Hazel Koitaba to represent the CEO of SHA. Is she here? So we shall get her. And last not least, Dr. Daniel Mwai. Dr. Daniel Mwai is the Presidential Advisor on Health and Standards in the Executive Office of the President. Welcome, Dr. Mwai, and a round of applause for him.
So first, a brief remark. As you all know, one of the key commitments
of the President of the Republic of Kenya is the delivery of universal health coverage. And this is covered under the four pillars. One of the pillars is human resources for health. The other pillar is commodity security. And the last pillar is a comprehensive integrated health information management system, what you call the digital superhighway. So, Mark, the rollout of digitization and the digitization program. And with me here is a team of panelists that shall be able to discuss the key questions that are there. And I'll start with you, Dr. Ganda. So leadership is a very critical, important pillar in the rollout of this program. So the first question to you is, what is the role of leadership? And from your past experiences, what have you learned? Are there any steps we might have missed, the challenges, and what we need to improve on, using an example of what is happening in Kisumu County? Thank you.
Thank you very much, Dr. Threnera, for that question. I think I'll talk to it very broadly because if I go to very specifics, then I might not touch on what has to come out. But you realize whenever you want to do any transformation or any radical change, nothing moves without leadership. And that leadership starts from political leadership. I want to take an example of the social health insurance. When we started talking about social health insurance and transforming the country, many years ago, when we had the former president, Kibaki, and it was a so-called Gilu Bill. That bill went and was passed in parliament and died there. It took us another 10 years. So before the politics decides that this is the way to go, and that one of the things that I think that the health sector succeeded in is making sure that this was an agenda of all the parties which were coming in. So the first is the top leadership in political, and you have seen how you can pass bills and make them work within a short time if all the political leadership is in it. Now, coming back to Kisumu, where I come from, my governor, Professor Peter Anyang' Nyong'o, has been a strong believer in social democracy. And we can see when he became governor, this is the first thing that he put in the manifesto, that one, we must be able to take care of the indigents and everybody must get equal health care. Two, we must be able to digitize our systems. Now, he started all the way from the community health all the way upwards. And when we started doing this, it looked like a very expensive thing, and I'll take very short time, that we asked the county assembly to pass a 130 million, which is almost 30% of the recurrent budget, to digitize community health systems. Now, that would never have passed through without political leadership. So the first agenda, and I think I'll end there, is if the political leadership decides that is the way to go, the whole system gets aligned, the whole technical team gets aligned, and resources are gotten to make sure that things work. Thank you.
Thank you very much. Dr. Angeline, just to build up on what Dr. Ganda has done and has said, you have your experience from Nandi County. You have heard what Kisumu County has been doing, and there's a critical role of political leadership. Share with us your experience about Nandi County.
Thank you. Leadership is critical, as Dr. Ganda has alluded. In Nandi County, we've just begun the process of digitization of health services. We started in April by mapping out the service points to determine how much resources we needed in terms of the digital gadgets that we needed. We also needed to sensitize our health workers, and political goodwill is key because you need everyone on board, even including the members of the assembly. They are the ones who pass our budgets in terms of the expenditures. So without which, we may not be able to achieve what we desire. Thank you.
Thank you very much, and thank you for that. Dr. Brian, Rufa is one of the private hospitals, and you know private and faith-based hospitals play an integral role in delivery of healthcare. Secondly, is that you have been in different spaces whereby you have been advocating for a lot, especially in the healthcare space, change, digitization, issues of payment, share reimbursements and such. You are here with the decision makers, and I can see most of them in the room. First, it's to tell us your experience as private hospitals through this digitization agenda. And secondly, your proposed areas of improvement based on your experience as Rufa. Thank you.
Thank you, Dr. Thuranira, and thank you for this invitation. Now, as a representative of private healthcare facilities, we appreciate the change that has come through digital transformation, and we think that it is one of the most fundamental changes that has happened in the Kenyan healthcare space since independence. So we welcome it. We are looking forward to be part of it. But you ask me what has been our experience. So first, we are frontline healthcare workers. We deal with the SHA provider portal every day. We also interact with the registries daily. We interact with the HIE every day. And therefore, we have seen its successes and challenges firsthand. Now, let me give some of the lessons we have had. Number one, we discover that stability comes first. We think that no matter what kind of good rules or workflows you have, when the system is unstable, then the rules and workflows don't matter. So for instance, and we have been very vocal about things like OTP delays. We have been vocal about things like how they disrupt service delivery. Now, the other one is, another lesson we have picked up is predictability is as important as stability. So what do I mean? I mean that, for example, when we have a change in the rules, for example, eligibility, pre-authorization workflows, that kind of, to use a term, policy ambush. We need to make sure that we don't have policy ambush and we have a system that is predictable. Thirdly, we have learned that integration is very important. Let me explain, and I'm happy that Nandi County is on the digitization journey. You know, Kisumu is leading, Muranga has done a very good job. But as it is now, every single provider in the country, and I'm hoping, and I can see it's going to change just based on what I have seen from DHA, but every single provider in the country, whether public, private, faith-based, any hospital today is operating on 2 different platforms. So there is a lot of duplication and a lot of opportunity for error. So this is what happens. You see patients on one platform, maybe your HMIS, and when you come to dealing with claims, you then transfer and start working on a different platform. This has generated a lot of challenges. And I'm hoping that by the time other counties digitize, we should be in a place where you can work on one platform and be able to do all your claims, but also be able to see clinical workflows, inventory management, all that. Lastly, on this issue is support gaps. Now, one of our experiences has been that when you have an issue as a provider, do you talk to SHA? Do you talk to DHA? Do you look for the vendor? Who do you find? So we think that the future is a unified help desk that allows providers to get help at one go. So that if I need an issue to be addressed by DHA or by SHA, from a provider point of view, I should not know who I am dealing with. I should just have one single interface.
Thank you, Dr. Leshanga. Dr. Kariuki, KMPDC plays a critical role in the delivery of healthcare. You represent the regulators in this panel discussion. So you register facilities, you basically panel facilities, and then you also register healthcare workers and maintain a clean register of them. How has that role been achieved, and what interfaces have you had with the Digital Health Agency and all other intergovernmental agencies in the delivery of that service?
Thank you. Well, thank you very much for the invitation. I think in the recent past, we've seen a lot of potential in ensuring that we do integrate our systems between the various regulators and the various agencies within government and all stakeholders in the health sector, whether public, private, private for-profit, private not-for-profit, to ensure that services reach the people in a more organized manner. I think there has previously been quite a lot of silo, separate entities holding separate data. And we've just realized that we do hold quite a lot of information that we have even previously not been using. But now it's becoming more useful to ensure that we are able to provide services as should be given. And I think it also brings out the fact that there's still a lot of potential to harness more from what we already have as we collaborate towards ensuring that we achieve the vision that we have intended.
Yeah. Thank you. Dr. Moy, welcome to this panel. You are part of the team that came up with this great agenda. take 2 or 3 minutes to explain to us what this digitization agenda looks like, and for Kenyans to understand where we started and where this agenda is headed to.
Thank you very much. I think the issue of digitization in the current era is almost self-explanatory. But I think the key important thing is the fact that looking at how healthcare systems have operated over time, we have had silo operations where, one facility operates somewhere in a remote area without any way of communicating with the other healthcare system. And therefore, the digital superhighway became an important component as an enabler of good service provision, quality access, the issue of people being able to pay for it, and also, availability of the same within the villages. And I think there are critical components that we cannot forget within this digital superhighway. One, the ability of people to identify themselves uniquely and to seek care within the facilities which are closer to them. The second thing was the issue of telemedicine, which became an extremely critical component in enabling even those in the remote areas to access quality care, even if the human resource challenge still persists, because it takes time to build up a human resource that, of course, will be available within all the physical locations of our facilities. The important thing that we cannot forget is the issue of the loss of our commodities that the country has had over time. So, in the past,
So welcome, Waziri, to our panel discussion. We were answering questions from the panel. We are getting responses from the questions we have from the panel. So welcome, Waziri. So Dr. Mwai, I will paraphrase the question so that Waziri joins and understands. So you are telling us a brief about the digital superhighway agenda, where it's headed. With that, you can also answer the question on supply chain. What is the role of digitization in supply chain and commodity security and availability of commodities, especially against a backdrop of, it has been reported that there has been having commodity expiries and such. Thank you.
Thank you. So the highlight I was giving was the fact that when the healthcare system was disjointed and no one was able to see what is happening in one corner of the healthcare system, and inability to also track, the service delivery across facilities, then we used to have people come from a facility that is down there. They have to carry a file to go to another hospital after a referral. And if you don't get that referral, you don't get the file, then you go and start from zero in the new facility that you have gone to. So with the shared health record that was mentioned earlier here, this problem became solved. We also have had a problem in the commodities that we have in market. We have a lot of fake commodities that have not. Digitization is to unlock access, improve equity, so that those who have been left behind actually can access services. The marginalized can also be accessed. We get efficient way of delivering services to the people who require those services more. And this is the spirit that have enabled the birth of the Digital Health Agency, a new agency that is unique in its own way, and one of its type actually in the world, where we have very few countries that have been able to roll out a specific agency to handle the health digitization, because health is key for everyone. Thank you.
Thank you, Dr. Mwai. Dr. Angeline, I'm back to you. In your presentation, you told us that Nandi County had started the digitalization journey. You told us that you have already done the facility assessments and trainings have begun. Just tell us the situation currently in the county, how far you are in that process, what have you done, and what challenges have you experienced? Thank you.
Thank you. I want to say that Nandi County is a toddler when it comes to digitization. We began in April with the mapping and redistribution of the gadgets. We adopted the Tibabu system, as was advised and supported by the national government through DHA. And we began with the primary healthcare facilities. So those are the facilities that are integrated. The level 4 facilities are following suit. Why there was a delay is because of the modules that have to be configured to reflect the services that are delivered in those levels. Our level 5 facility, we are yet to connect to the system. However, I want to appreciate the fact that the key component is ownership of the process, starting from the top leadership of our governor, His Excellency Stephen Sang, because he's the one who launched the digitization of services. And that makes it easy down the chain. And also we sensitize our staff on the importance of this, because without their ownership, they are the champions, they are the implementers of the system. Now, what we've learned in the process is that we have attained about 60% digitization of the primary healthcare facilities with a dashboard that we are able to see what they are doing every day, the number of patients seen, the number of patients booked for the clinics. We are able to see the number of SHA claims that they are doing. We are also able to note the workload. We are able to see the facilities that have higher workload against the number of staff that they have. And this gives us an opportunity to redistribute the staff, where we find the workload is low, and yet the numbers are relatively higher than other facilities. I also want to say that one key component is knowing your facilities, knowing the needs of the clients and also the health workers, the ability to adapt to digital systems and use them. We found that we have staff who are above 50 years of age, and most of them have challenges. And I think going forward, those counties who are going to adopt digitization, when you go for training, the TOTs, it's important to select the younger staff population who are able to catch up and be able to push the process forward. Thank you.
Thank you very much, Waziri wa County and Andy. So, Dr. Ganda, tell us the situation in Kisumu. Building up on what Dr. Angeline has told us, what they have done, 60% of the facilities being digitized. How is it in Kisumu now?
Thank you very much. I think Kisumu is younger yet older. Kisumu started digitization much earlier, and I think almost 40% of our facilities were digitized. But then, all those facilities were silo facilities. That means that if you moved from facility A to facility B, you are a new person. You have to start afresh, they register you and get all your data. And so, yes, we were digitized, we had a lot of innovations, but then we did not have that interoperability layer being brought forward, even though we were even using the same system. We were mainly using Kenya EMR system in most of our facilities. We have now activated the Taifa Care system, and we will be now moving into the digital superhighway. The Kenya EMR system is being upgraded into a newer version that can be able to link. We will then be able to discuss on how we can save this data, because once you start generating data, initially, most of our data was in several places because of the partners, and you know the USAID and the US government is transitioning into a locally run system. And so the DHA will have to provide at one point a repository where all this data will be coming into. Once they have provided that, we will have to change the kind of tablets that we have, because we have been paying for the internet. The partners have been paying for the internet, and we have been supplementing this so that we're able to have all-round internet in our facilities. I think coming in with the DHA will allow us now to have internet provided for all those facilities. Despite all this, yes, we still have challenges with internet connectivity in the whole county. I think Kisumu, Homa-Bay has better internet than Kisumu. We are at 60%, Homa-Bay is at 90%. So we have been able to buy Starlink to boost these internets so that all our facilities are able to get internet. And then we'll be all of us together in the digital superhighway as Kenyans and not silos. And I like saying that counties are independent governments, but they are interdependent and work closely with the national government. So as we do our innovations, yes, we are working together with national governments to make us move forward. Thank you.
Thank you for that. And I'm happy that you have become proactive, facing your challenges head on and sorting them out. Dr. Lishenga, what is the status of digitization of the private facilities and FBO, and where can DHA step in to support? Thank you.
Thank you, Dr. Thuranira. I would say, so we did a survey 2 years back on the status of digitization. And what we found out is that for private and faith-based facilities, about 60% of them operate, are digitized. So we still have somewhere between 40% gap. Now, in terms of where DHA can come in to support, my conviction is that we need to move to co-creation and start doing things together. So for instance, one of the things that is very exciting is to see counties like Nandi County, taking up HMIS systems. We need to support private sector and faith-based hospitals to do the same so that they can, and this can happen through validation of existing HMISs within the private and faith-based. So one of the things that DHA can do is, because private sector will operate slightly differently, is to move to an open source kind of arrangement where you validate the HMISs that are out there and find out whether they meet the criteria set out by DHA. Another opportunity is, I think, in incentivizing facilities that do the right thing in terms of digitization. So for example, real-time claim adjudication can help facilities unlock capital. So, and I had Mwai talking about the supply chain. Real-time claim adjudication can help us with unlocking inventory, for example. So we think that working to co-create with private sector is definitely the future for DHA.
Thank you very much. Dr. Kariuki, as a regulator, what is your experience in regulating facilities and regulating healthcare workers, and how can DHA help you sort out all the challenges that you experience, as you give us your parting short remarks?
Thank you. As regulators, we implement government policy through legal frameworks. And so ours is largely to keep minimum, the standards and norms that are expected to be able to provide quality care for the needs of the population. And we do continuously support facilities to be able to maintain the standards or even take them higher than what they have been having. In terms of the health professionals themselves, we also maintain the standards right from the training, then ensure that everyone is registered and licensed to practice within the scope of the training that they had achieved. Okay. For example, when it comes to the health facilities, 2 years ago, we only had about 10% of public facilities voluntarily applying for their annual licenses. But with the reforms that have come, we are currently at 97%. Okay. And the remainder is largely from the investments that they keep making. So there's a lot of work going on.
Thank you very much. Dr. Mwai, a quick question. Which is the way, what's the way forward now after this? What's the way forward? You have seen what you have done. You've seen what DHA has done. You have had the challenges from the county governments, challenges from private and faith-based facilities. Give us directions on which way we head after this.
I think the key call is that the DHA is ready to work with the counties, and I think this has happened And the call is for the counties to work with the Digital Health Agency to roll out the digital superhighway, address the issues that are happening within different counties, unique to them. And I think the ultimate is when we have a complete superhighway where the DHA is running it with critical support, county governments, and that will give us a successful integrated healthcare system. Thank you.
Thank you very much. Help me thank the panel that joined us. The panel, you may now exit the stage so that we go on to the next part. Thank you very much, Dr. Angeline from Nandi County. Dr. Kanda, thank you very much. Dr. Lichenga from Rupa, thank you very much. Our CEO, KMPDC, thank you very much, and Dr. Moai. At this juncture, allow me to welcome Dr. Engineer Anthony Lenayara for a brief remark and to welcome to usher us into the next part of the program. I've been your host, Dr. Thuranira Kaugiria, and thank you very much, good people. A clap for our CEO, good people.
Thank you, Dr. Tunarera and our panelists. CS for Health, Nabadan Duale, EGH, Governor's Presence, DG, Chairman Digital Health Agency, and our board, CEOs present, CEO SHA, CEO KEMSA, CEO KMPDC, all protocol observed. Good morning. Good morning again. Waziri, welcome to this side event. This is a side event for the Digital Health Agency. I'll just give a few remarks and then we move to the next part of the program. We are here today to assess ourselves on how far we are for the last 1 year. 1 year ago, we declared that the future of healthcare will be universal, accessible, digital, connected, and inclusive. We recognize that our people deserve more than just basic healthcare. They deserve a system that works for them whenever they are and whenever they need it. Today, as we gather, we want to evaluate how far we are on this. What are the gains? What are the opportunities? And where are the pains? Just to give you a high level, in years and our ministry, in digitization transformation agenda. As we sit here today, we are rolling out Taifa Care Hospital Management Information System that makes each and every public hospital to go paperless. We are in 24 counties and counting, and we expect to complete in all counties by November, making identification of systems across the 25 million Kenyans who are in the USC program possible. Every patient today is uniquely identified through the client registry integrated to our registration bureaus, eliminating the need for physical health records and physical health cards, and preventing fraud under the Social Health Authority. All healthcare facilities and professionals are now uniquely, seamlessly identified through our regulators, eliminating fake doctors and fake facilities and provision of services by unqualified health professionals to the Kenyan people. Patient portability is now a reality in Kenya. Our shared health record today is able to move data and information of patients from one hospital to another in all the hospitals that we have done the Taifa Care rollout. This not only eliminates the need for big files and documents across, but also duplication of charges for simple things like tests of X-rays and MRI for Kenyans by different facilities. Our Social Health Authority is now fully digitized. Kenyans today can register in the comfort of their home for the social insurance. They don't need to know anyone. They don't need to go to any office. They register at the comfort of their home. That's why today we have 30 to 50 testers at the comfort of their home. We have gone further. As we know, not everybody has a smartphone, to introduce simple solutions that help the Kenyan people at the rural areas to be able to access to the Social Health Authority. Our USSD code, *147, is fully functional, and it represents the whole government because it means one government, their USSD. Pre-authorization used to take, under the previous NHIF, between 72 hours to 3 weeks. Today, you get your pre-authorization codes approved in less than 15 seconds. This is efficiency, and we have ensured that our Social Health Authority is fully digitized and provides services efficiency. As we continue with the digitization, we take note that technology cannot serve without having an efficient and digitally enabled health workforce. We are training all our health workers from every public facility. We are training them how to use our digital systems and use our digital platforms to provide services more efficiently and treat Kenyans the quickest way possible. We have so far distributed 15,000 devices across all the facilities that we are doing rollout, and we will distribute 74,000 devices to each and every health worker in a public facility or a public hospital. These devices comes with internet, paid up within the program to ensure that no health worker is not able to access internet to provide services. These are not just achievements or statistics. They represent real life being impacted across the country. However, throughout the last 1 year, we have also faced some challenges. One has been the connectivity issues, which we are currently addressing together with our Ministry of ICT to ensure that each and every hospital has stable power as well as has connectivity and internet. Two is the change management, training people to leave the paperwork that they are used to and start using systems within the Taifa Care ecosystem. This is still a challenge we are working together, and we are working together with the counties. Our training programs is embedded, not only understand how system works, but they embrace and understand the importance of it. There are still a lot of opportunities. These are just foundations that we have created to ensure that Kenya has a fully integrated, intelligent health ecosystem. We call upon each and everyone to come and partner with us to ensure upon each and everyone to come and partner with us to ensure that enabled. Aligned with the Ministry of Health strategy, we today are going to launch 3 key documents that are going to govern how we provide digitization. One is the Digital Health Agency Strategic Plan, which gives CS for health. I think that was my short speech. I want to welcome my colleagues, CEO Shah, just to make a brief speech, and then we can proceed from there. Karibu. We and Shah are like twins because we digitize Shah, and sometimes the Kenyan people don't know the difference between DHA and Shah. But see us as twins that enable one another to ensure that the Kenyan people are served and served well.
Thank you. Thank you, Engineer Anjoni, for this opportunity to address the team here. I think at SHA, what we can say is that we are really benefiting in terms of the thinking of this Taifa Care initiative to be able to have end-to-end digitization of the claims processes. When we came in, the panel before was sharing really the way forward and what this will look like. And I'd like to borrow the remarks of Dr. Moi. Once upon a time in Kenya, there was very little visibility of when a patient would walk into a hospital, the services that they would get, the lab work that would be done, the treatment protocols that were issued, and then the discharge of the patient, and even the follow-up of the patient. But with our collaboration with the Digital Health Agency, we now have back-to-back full-end visibility of a patient and a patient's journey. And if we look at what is coming up next, what is left undone, which we are working on, is that every Kenyan will be able to have access to their record of services. It means you as a Kenyan will be able to know in January you went to the hospital, 2 years later in February you had your CT scan, 3 years later you went in for this surgery, and that really is monumental for us. One, as we adjudicate claims, but two, for you as a patient, as we make sure that you get quality health services. And then for us in SHA, our partnership in DHA continues. And really, if you look at the work that has been done from the inception of this program to date, we're extremely pleased and there's more to come. As highlighted by Engineer Anthony, in the last few weeks, we've already activated key technological solutions. One is biometrics, and as we continue rolling out and reaching our lower tier hospitals, it means that every Kenyan will be able to protect their cover, they'll be able to access their cover, will be able to pay for the right claim. If you look at the Healthcare Workers app, again, it allows for us to ensure that you get the services that you need from a healthcare worker who is not a quack and who then has offered you a service. And so for us, we're really seeing a lot of investments in technology that have helped us and that will help deliver the dream of UHC for Kenya. So thank you, Engineer Anjani. Thank you.
Thank you so much, my sister, CEO Shah. Waziri, now I want to welcome the World Health Organization representative to make his remarks before we proceed. Karibu sana.
Honorable Adam Aden Duale, Cabinet Secretary for Health, PS for Medical Services, Dr. Uma Oluga, the CEO, SHA, Dr. Mercy Mwangangi, the CEO, Digital Health Agency, Engineer Anthony Lenayare, governors, county health executives, distinguished partners, ladies and gentlemen, good afternoon. On behalf of the World Health Organization in Kenya, I thank you for this opportunity to join you at this Devolution conference convened under the banner For the People, for Prosperity, and devolution as catalyst for equity, inclusion, and social justice. This side event focuses really on how digitization advances equity, justice, and inclusion, speaks to the heart of the promise. For WHO Kenya, this conference is pivotal. For us, we gather here today in Homa-Bay County, not merely to reflect on progress, but to chart a bold and inclusive future for healthcare in Kenya. One that is powered by digital transformation, anchored in the conference's central theme of equity, justice, and inclusion. As we stand at this intersection of Kenya's devolution journey and its digital health revolution, we witness firsthand how digitization serves as a powerful equalizer, breaking down barriers that have historically prevented Kenyans from accessing quality healthcare services. Today, I speak not just as a representative of WHO, but as a partner deeply invested in Kenya's remarkable transformation into a global digital health leader. Let me frame the why for this side event about digital health for equity, not just for efficiency. Recently, WHO member states extended the WHO Global Strategy for Digital Health 2022-2025 to 2027, and actually even requested for a next phase for 2028 to 2033. The signal from WHO member states is clear. Digital transformation must be people-centered, rights-based, and explicitly advance universal health coverage. WHO's guidance on ethical use of AI, especially the LLMs, reinforces this imperative to deploy innovation where it measurably improves outcomes and protects populations. Regionally, we do have the WHO Afro implementation framework, which guides the countries, including Kenya, to translate this strategy into action through governance, workforce capacity, interoperability, as well as equity lens, principles that align with the devolution. For Kenya, we are very proud of the great work being done here. There is an enabling environment, very strong political leadership of this initiative, strong laws, and clear rules. Indeed, Kenya has built one of Africa's most legal foundations for digital health. The 4 pillars really matter for this conversation. One is the Digital Health Act, which establishes the Digital Health Agency and mandates a comprehensive integrated health information system. The second is the Digital Health Regulation, the legal notice number 76 of 2025. There is also the Social Health Insurance Act and the Primary Health Care Act, which links financing and service delivery, so digital tools translate into entitlements as well as access. Finally, there is also the Data Protection Act. This clarity that these legal frameworks have provided is timely and welcome. As has also been noted, we look forward to the launch of 3 strategic documents by the Cabinet Secretary, the Digital Health Agency, Digital Health Authority Strategic Plan, the Digital Health Solution Certification Framework, as well as the Digital Health Authority Standards and Guidelines. For us, these are not just policies, they are instruments for transformation. Distinguished partners, ladies and gentlemen, let me just say a few words on equity in action, especially the community platforms, data flow, and claims. As has been shown, the Kenya's 108,000 plus community health promoters brings service closer to households. The electronic community health information system now connects the community encounters to facilities and the Kenya Health Information System, thereby accelerating decisions and closing referral loops, as has been referred to. These are real equity gains for Kenya, especially in the hard-to-reach settings. On the financial end, the SHA has stabilized digital claims processing, a very essential step to turn service delivery into timely payments. Just a few words again also on the devolution advantage and counties, especially counties as engines of inclusive digitization. The devolution brings proximity needed to design for language, literacy, connectivity gaps, disability inclusion, and gender dynamics. This also, the human rights and social justice framing of today's program is therefore for us the correct lens. It measures digital health by who benefits first, not just who is already connected. For WHO, we provide 5 design tests for equity, justice, and inclusion. For us and for the global health community, before any solution scales, WHO proposes that counties and vendors must pass this test. 5 of them. 1, access. The system must work offline, degrade, and also be able to degrade gracefully on low-end devices, 2G or 3G. 2, usability. The contents in Kiswahili and relevant local languages, low literacy designs are essential for usability. 3, safety. Clear clinical scope, human oversight. 4, protection as well as accountability, which logs, metrics, and user feedback loops, made accessible to counties and communities. From the discussion so far, these are already being put in place, so this is really great for the government of Kenya and the leadership. Looking forward, we want to propose some practical steps that the country needs to fully implement. To translate, second, 1 certified stack for priority. Second, 1 certified stack for priority use cases. For example, antenatal care immunization, NCDs per county, also procured against the DHA certification framework. 3, 1 protection drill per county. We ensure that, especially at this point where we have issues of hacking, we also propose as part of this compact 1 protection, advanced, and we also provide you global platforms to align your resources and work with you on benchmark progress openly. In conclusion, let me reaffirm WHO's unwavering commitment to working alongside Kenya on this remarkable digital health journey. Together, we are not just digitizing healthcare, we are democratizing access to quality health services for every Kenyan. The future we envision is one where a mother in Turkana can access the same quality of digital health services as one in Nairobi, where a community health promoter in Homa-Bay has the same digital tools as specialists in Kenyatta National Hospital, where equity, justice, inclusion are not just aspirations, but actually everyday reality for Kenya's digital health ecosystem. WHO stands ready to continue this partnership, supporting Kenya's vision of a digitally inclusive health system that leaves no one behind. Together, we will ensure Kenya's digital health transformation becomes a global model for health technology. Sana. Thank you.
Thank you so much. Because of time, I will invite Chairman of DHA just to say one word. DG, please come closer, and then DG to take over the program and conclude. Chairman, DHA, please.
Our Cabinet Secretary, Honorable Haden Duale, our DG Health, Dr. Amoth, WHO County Representative, Chair Health COG, digital health stakeholders, national and county government officials present, conference delegates, ladies and gentlemen, good afternoon. Welcome to Digital Health Side event. The DHA has been in existence now for 1 year. And as chair of DHA, I'm happy to report that we have navigated through both operationalizing and as we began, we are implementing in earnest the Digital Act 2023, and like we always say, we have done what we thought, much more than we could do, and we are born and we are already running. The agency recognizes its monumental role as a crucial enabler in the delivery of universal health coverage through use of technology to transform how health is delivered. In the past, the DHA, through intentional collaboration with partners, has been able to deliver digital solutions that are boldly contributing strategically towards improving how healthcare is delivered in this country. Esteemed conference delegates, investments in digital health hold great promise for transforming healthcare systems and improving health outcomes. It is our aspiration that digital health transformation will result promotive and curative. At the agency, we are inspired by the Japanese Kaizen philosophy towards continuous improvement. Today, we get an opportunity to reflect, that is, smile at what went right, learn from what we did not do as planned, and visualize what the future holds as regards optimal digital health transformation. Ladies and gentlemen, in conclusion, the agency is launching its first strategic plan, resilient, future-ready, and people-centered, all who have been part of the DHA's journey. The commitment and support from Ministry of Health leadership, led by our indomitable CS, Aden Duale, has also been truly inspirational. Thank you so very much, Wasiri. Asanteni for joining us today. I now welcome our DG Health. Take over.
Thank you, Chair. Honorable CS, allow me to ride on prior established protocols because of time. The transformative journey towards digitization of health services in Kenya has begun, and great progress is already demonstrated. Coverage has already reached more than 50% of the countries, and we are on track to be able to achieve 100% coverage before the end of the year. And we are already celebrating the dividends of this investment, as clearly highlighted by the CEO of Digital Health Agency. We have reduced turnaround time for our pre-authorization processes. We have upped our fraud detection mechanism, and through track and trace, we have enhanced our capacity for pharmacovigilance and accountability in our processes. Data is the new currency, and now we are collecting real-time data, and this data is also hosted in-country, and therefore it is easy for us in terms of decision-making. This work is not only taking place at the facilities, but it's also happening at a community level. We have the electronic community health information system that also collects data at the household level. We are soon joining the League of Nations, who collect data on a day-to-day basis, real-time, rather than wait for periodic surveys conducted every 5 years, like the Kenya Demographic Health Survey. Therefore, this is the right thing to do, and for sure, it is going to have a transformative change in our health ecosystem. Allow me to invite His Excellency the Governor of Tharaka Nithi County, who is also the chair of the Health Committee at the Council of Governors, to make some remarks and thereafter invite our chief guest for the event. Your Excellency. Mtamwambia bonyeshe liji ya kulaunch hizo documents.
Thank you very much, Dr. Omoth, our substantive DG. Honorable Hadan Duare, the CS for Health, and for the sake of time, all protocols observed, I recognize you all and I salute you. We are running against time because there's another event taking place here, and for that reason, CS allow me to make very brief remarks. First and foremost, I want to thank the DHA team led by Engineer Anthony. From where we sit as the Council of Governors, their partnership has not been without hitches, but it is one of the best agencies we work with, because from where I sit, DHA has gotten us from a habit that we had in Kenya, where we used to have a book called Kitabu ya Hospitali. It used to be half a book, and our patients used to carry them along with them everywhere they go. And the biggest killer of patients in Kenya was not the wrong diagnosis, it wasn't lack of medicine, it was inconsistency of health records that made doctors treat patients who are referred with the same treatment they had in the previous treatments or visits, without realizing that that was not working because there was no record. The birth of DHA from the three laws that were passed, courtesy of Kenya Kwanza, has come to resolve this problem, and our patients are very happy nowadays, walking to hospital, carrying nothing, and they find the records there, even the records of the hospitals they visited before from their previous visits, which are not necessarily the same hospitals. That is a game changer. We are looking forward to a time when a patient in Kajiado will have the need to be seen in Bagathi, and they just walk in, give their ID card, and their records will be there, with their data being correct and also protected, because that is very, very important, not just to us as a country, but also for the patients. So data protection is something that we need a guarantee on, Anthony, because that has been our biggest worry as Council of Governors. I'd also like to, at this particular time, hail you for giving us a promise to give us end-to-end visibility, which includes a dashboard for the CEC in charge of health, also the governor. And I am briefed that that system works on and off, but I'm sure with the effort you put to reach out more counties, this is an issue that will be resolved. Lastly, counties had existing systems or digital health systems. Some of them were inferior to what DHA is offering. Some of them have resistance in accepting DHA because they feel they have had an investment. But if you're giving me a Ferrari and you're telling me to crash my VW, which is very old, I would have to make my calculations so that the VW serves any purpose. We are therefore urging the county government, if you have a system that's inferior to a DHA system, it does not matter how much you invested in it. If the DHA system will serve you better, you had better take that one. With those very few remarks, it's now my humble duty to call the CS Health, and even as you comes, and let's give him a clap. Counties have committed to give free treatment in level 2 and 3 and 4 but CS urge patients also to make sure they register for SHA, because you cannot get treatment if we don't know who you are. They must register. Thank you very much.
The chair of Health Committee of the Council of Governors, Excellency Governors and Deputy Governors, Senators, Honorable Members of Parliament, County Assembly, senior national and government officials, our partners, distinguished guests. Ladies and gentlemen, it is my distinct honor to attend this year's Devolution Conference in the beautiful county of Homa-Bay, as we reflect on the theme for people, for posterity, devolution as a catalyst for equity, inclusion and justice, social justice. I am particularly delighted to contribute to this dialogue from the perspective of health care digitization. Universal health care remains one of the most important, powerful tools for advancing equity, justice, and inclusion. Yet many Kenyans, especially in the remote and under-served areas, still face barriers to timely, quality, and affordable health care. Digitization offers a unique opportunity to bridge these gaps. It is more than technology. It's a transformational tool for efficiency, for accuracy, for equitable access, for transparency, and for citizen engagement and empowerment. The Ministry of Health has made digitization a core pillar of the ongoing health sector reforms through very key initiatives, including the Taifa Care digital platform, which integrates healthcare records, telemedicine, insurance management, facility data, and to make sure that we provide care, we prevent fraud, and we improve patient safety and experience. We are also doing community health digitization through the Smart CHAP app. Community health promoters can now register households, report illness, track maternal and child health, and make referrals, hence boosting our surveillance, our responsiveness, and our accountability to the people of Kenya. On supply chain and resource tracking, we now provide real-time monitoring of medicines, vaccines, and medical equipment, reducing stockouts, wastage, and disparity. And finally, on health financing and inclusion, using our digital IDs and mobile money to enroll vulnerable population into the social health insurance, hence enhancing financial protection and reducing unnecessary cost. Ladies and gentlemen, devolution has been a game changer in aligning health priorities with the local realities. Counties are best placed to implement innovations that meet the specific needs of their population. The Ministry of Health continues to work closely with the county governments in the rollout of digital health infrastructure at all levels. We are working with you to build capacity of health workers and ICT officers. We are working with you to strengthen data governance, privacy and cybersecurity, and we want to make sure, colleagues and partners, that equity is not an outcome, it is a deliberate choice. Inclusion and justice in healthcare must be embedded in our system design. We want to ensure that our platforms are accessible to persons with disability. Our platforms are available in local languages. Our platforms are gender responsive. And our platforms are affordable to all. No Kenyan should be left behind in the digital health revolution. regardless of their location, their income, and their identity. Kenya digital health transformation is here and is real. It's reshaping how we deliver care, improve efficiency, and safeguard public resources. Through the Social Health Authority, the ministry is using technology as an engine for equity, accountability, and trust. Since October, SHA has disbursed 57.7 billion to health facilities, and of these, 49.7 billion was channeled to the Social Health Insurance Fund and emergency, chronic, and critical illness, while 6.7 billion supported the primary health care fund. And let me make it very clear here. Our primary health care fund is the one that makes Kenyans to access outpatient in level 2, level 3, and level 4 free of charge, paid by the government of Kenya, appropriated and budgeted by Parliament. When fully integrated, biometric verification will work with real-time claims processing, enabling instant eligibility checks, faster reimbursement, and accurate data, patient data across all our counties. Beyond fraud prevention, this system builds citizen trust and provides actionable insights on service use, on the trend of diseases and spending in order to allow us to make smart investment and fast response. Ladies and gentlemen, Kenya experience demonstrates that digital health innovation, when anchored in sound policy and sustained by strong political will, as shown by the President and the government, and those of us who work with him, and our county governments, we can deliver a patient-centered, fraud-resistant, data-driven health system, serving a model for Africa health resilient agenda. And in this spirit, today is a significant milestone with the launch of the Digital Health Agency Strategic Plan, alongside other guiding documents. This will serve the compass for advancing our nation's health digitization agenda. In conclusion, we reflect on the next frontier of devolution. Let us reaffirm our collective commitment to equity, justice, and inclusion through technology-enabled health system. The Ministry of Health stands ready to walk this journey together with all our partners, all our counties, and our communities. We will close the gap and we will open the future. With those many remarks, it's now my duty and honor to launch the Digital Health Agency Strategic Plan. What's happening? Yeah. Please, let's clap for DHA.
Purchase your tracks today.
Can we get copies? You will not expect hard copies. This is digital. Colleagues are asking me where the copy, so I told them this is digital. So you get your copy digitally, online. Thank you very much.
May we appreciate the CS for Health, Honorable Aden Duale, and his team once more. A better round of applause, ladies and gentlemen. Thank you. Allow me to welcome Tabby and the band for one number as we prepare ourselves to welcome our keynote speaker, His Excellency Engineer Dr. Raila Amolo Odinga. Welcome, Tabby and the band.
Unaweza Yesu, unaweza, hakuna kama wewe. Unaweza, unaweza Yesu, unaweza, hakuna kama wewe. Twakuinua, tunakupa sifa yoyo, unaweza, hakuna kama wewe. Unaweza, unaweza, unaweza. Unaweza, hakuna kama wewe. Tunakupa sifa, wewe mwaminifu. Unaweza, hakuna kama wewe. Unaweza, unaweza Yesu, wewe unaweza, tunakuinua. Unaweza, hakuna kama wewe. Bwana wa mabwana, unaweza, unaweza. Tunakuinua wewe, unaweza, hakuna kama wewe. Unaweza, unaweza Yesu, unaweza, hakuna kama wewe. Wewe kimbilio, nguvu ya wanyonge, unaweza, hakuna kama wewe. Unaweza, Yesu wewe, haleluya, tunakupa sifa wewe, unaweza, Yesu yoyo, haleluya. Weka makofi mazuri kwa Yesu, anaweza yote, haleluya. Inyalo duto, inyalo duto, Rabi inyalo duto, onge machalo kodi. Ine matingi malo, ine miromo luongo yoyo, ine minyalo, onge machalo kodi. Inyalo duto, ngamalo ionge, inyalo duto, onge machalo kodi. Inyalo duto, inyalo duto, baba, Yesu ine minyalo, inyalo duto, osiepoa, haleluya. Baba unaweza, 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 wewe kimbilio, unaweza, onge madendi kama onge machielo kendo
Thank you. May I request all delegates that are on the sidelines to please come into the main dome and take your seats. And those of us who are standing in this area as well, please do take your seats. I also request that all the sessions that we are done with on the sidelines, kindly, coordinators, may you get all the delegates now into this main auditorium, kindly. In the meantime, Tabi and the band are on stage, and thank you very much, Latif. I am told that now you're Dr. Latif. You have done very well since this conference began. Niombe sote tulio pembeni pembeni, tujongee na tupate kuketi. Wale ambao munashughulika na sehemu mbadala kwenye mijadala mbalimbali, ni waombe muelekeze wote wahusika na washikadau sehemu hii. Tabi.
Mboni wana no Taya Alungi ni taya mamenyo na yora Taya Ni wana no Ni wana no Taya Yo Taya Analungu ni Yesu taya manoresu kimana yo Taya Oge machielo kendo Taya Owila na teko ya ema no bende nyingi Taya Mito Taya Osip na yo Ine milo yo na nuenje Taya Kano na nuenje Kalweto kaja Taya Ni wanano na kwenye wadilamo Ine madendo ni kama Kama Taya Alungi ni Taya Ni wanano no Yesu Taya malipo wewe ni mwanga Taya No ni wana no Taya ne okangeo ni kobo enricho ne okangeo Taya okangeo ni kobo enricho ne okangeo Taya baba ki mama no kao di altero kajuo Taya
May I request that all of us who are on the sidelines, please, may we make our way to this main auditorium. And now, may I request that we all be upstanding as we welcome the keynote speaker for this very, very auspicious occasion, His Excellency, Engineer Dr. Raila Amolo Odinga, Tabi and the band.
Ni wara nono chieng jamudo ni wara nono okumbana moro ne okachulo nyasaye ne okachulo we moda pako siepnani we moda pako we moda pako siepnani
Thank you, Tabi and the band. Let's appreciate Tabi and the band with a mighty round of applause. And may I now request our good friends, members of the Fourth Estate, kindly, slowly, security, let's be polite. Let's be polite. Positions on my right. At a prayers. Thank you. May I request, in respect of our nation and our shared national values, may we be upstanding for the national anthem of the Republic of Kenya, to be followed by the East African Community Anthem. May I request a dress down for the anthems, and Sheikh Abdullahi will lead us in a short word of prayer. National anthem.
Jumuiya Afrika Mashariki, tuwezeshe kuishi kwa amani, tutimize na malengo yetu. Jumuiya yetu sote tuilinde, tuajibike, tuimarike, umoja wetu ni nguzo yetu, idumu jumuiya yetu.
بسم الله الرحمن الرحيم الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك نستعين اهدنا صراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين آمين يا رب العالمين.
Pema pako patazidi kubaki petu pakimbilio na nusuru. Mkono wako wa rehema na mkabidhi Rijali Shaki gwiji mngwana na adibu iwa mwandishi Raila Amolo Odinga ambaye ndiye mkunga wa ugatuzi. Twakuomba ewe Mola umjalie pamoja na magavana wote akiwemo Nala Gladys Atieno Wanga wa Homa-Bay. Na kikao hiki twakuomba ewe Mola anza nasi, uenende nasi na utue nasi pema, na ni kwa sababu tumeomba tukiamini katika jina tukufu la Yesu Kristo mwanao.
May we be seated. Your Excellency, the Prime Minister, Engineer Dr. Raila Amolo Odinga, Your Excellency, the Chair of the Council of Governors, FCPA Ahmed Abdullahi, Your Excellency, the Good Governor of Homa-Bay County, Honorable Gladys Nyasuna Wanga, all governors present, Cabinet Secretary for Health, Honorable Adan Duale, all Cabinet Secretaries present, Principal Secretaries and officials of national government, the Minority Whip in the National Assembly, Honorable Mili Mabona, and all members of the National Assembly present, the Minority Leader in the Senate, all Senators present, the Speaker, Homa-Bay County, Right Honorable Polycarp Kombo, all speakers of different county assemblies represented here, and members of various county assemblies, our partners, distinguished delegates. As I invite a good friend and a brother who has been doing a good job in guiding this auspicious occasion, since he came to Homa-Bay, now is known as Dr. Latif. But as he comes, allow me, Your Excellency, please, may we accord His Excellency, Engineer Dr. Raila Amolo Odinga, a hearty round of applause. We thank you for your efforts. Welcome, Latif. Karibu Daktari.
Thank you very much, Bagi. Good afternoon, ladies, gentlemen, and delegates. 2025, to the Right Honorable former Prime Minister Raila Amolo Odinga, to kick off this whip of the Council of Governors, who is also the governor of the great county of Nandi, His Excellency Governor Stephen Sang, to come and run the program, which will include taking us through the journey.
Thank you very much. Good afternoon, everyone. Good afternoon. Karibuni sana, thank you and welcome to this session. Again, Baba is in the house. Karibu, Your Excellency. The theme, an applause for Baba, please. Devolution Conference is for devolution as a catalyst of equality, equity, inclusion, and social justice. All of you will agree that if there is one Kenyan who personifies this theme, is none other than Prime Minister Raila Amolo Odinga, the Prime Minister of the Republic of Kenya, Baba mwenyewe. And therefore, we are very honored, Baba, that you could find time to be here with us. You have been part and parcel of the devolution journey in this country, and we are excited as a devolution family to have you around. We will start this session with a video, and the technical team, can you share? We will start with a small video on this, capturing this theme on behalf of the Council of Governors. Let's have that video, then we will proceed to the remarks. Technical team, please.
Kenya's devolution story is one of transformation, of power, resources, and responsibilities brought closer to the people, of voices heard, and of lives changed. From the vibrant urban centers to the serene countryside villages, devolution has touched every corner of our nation. But what does it truly mean for the people?
Devolution inamaanisha resources zimetufikia huko mashinani. Service ililetwa kutoka juu mpaka chini.
Wale wamechaguliwa mashinani wanafika kwa ile sehemu kila pahali.
Over the last 12 years, county governments have been at the center of service delivery. While significant progress has been made, there's a pressing demand for increased accountability, transparency, and inclusive governance in addressing the needs of the people.
Services ambazo tulikuwa tunapata national government sasa tunaipata mashinani.
We are at a defining moment in Kenya's history. It is time for the national and county governments to listen to the voices and expectations of the people and take actions that lead to the realization of the promises of devolution.
Changamoto moja ya mkulima ni lack of funds.
Tuko wagonjwa watano, lakini farm machines are not working.
We usually don't have the support from the government when it comes to sickle cell.
Equity, inclusion, and social justice are not just ideals, they are constitutional tenets owed to the people of Kenya. Devolution has reshaped Kenya's governance structures, empowering counties to deliver essential services from pre-primary education to healthcare, agriculture extension, trade, infrastructure, water, sanitation, and housing.
Devolution imenisaidia sana. Kama si devolution singetokea. Ningekuwa tu nakaa mashinani, naambiwa wanawake hawafai kufanya kazi. Lakini juu ya devolution, at least naweza jituma na napenda kazi yangu.
Despite the challenges since 2013, the impact of devolution is undeniable. You can see it, touch it, and feel it. Change is unfolding, one community at a time.
Before the unit was opened, we had a challenge. Most mothers opted to deliver at home, and we really had a lot of mortality. But once this unit was established, we are getting a lot of mothers are now coming to this hospital.
When it will later be 1.3.
Dialysis last year kwa hospitali hapa na this service imetusaidia sana. Patient wanatoka mbali na the best service ni hapa. Kwa county government tunaomba bado tuongezewe sheets patients wengi.
We usually have a very long list of patients who needs the services around. So patients.
To us by the county government.
Nalima mboga na nalipa school fees. Owi tina tunaye mambo kwa binda ya mbuga zizoka. Na yutu mambo kwa binda yonde. Na kede yutu ina tena munguno tunedana tena.
Kama iko kitu sasa inalete roho pande hii na watu wameshambulia kupanda ni mambo ya kahawa sasa hivi. Siku hizi hata wakina mama wanapanda, mzee amekatia mama. Sasa mama ako na akaunti yake analeta hapo. Sasa hii wakina mama wawajiliwa na ikao yao.
Tumekuwa na changamoto sana za soko, upande wa soko, kwa sababu kuna madalali wengi wao wanaingilia inputs wakati wakija kwa mauzo yao.
Tunapata changamoto ya barabara. Inakuwa saa zingine nyanya ikiwa imeiva sana kwa shamba, nyingi inaharibikia kwa shamba kwa sababu ya barabara.
Huu mradi haya maji yalianza kama ya community members.
Zamani ilikuwa chafu, ukienda kuichota unakanyaga matope chini ndio uchote maji. Maji sasa imepita imeenda mpaka kwa maboma.
Mambo ya maji. Kwenda huko nilikuanga msimu. Unaenda huko safari 2 3, umechoka. Wakapima wakasema, "Maade tunataka hii maji kufikia." Na mimi, fanyeni haraka oneni vile niko. Basi, ndio wakaniletea hiyo maji. Nilifurahi watoto yangu, niliona furaha.
Members wao ni wale watu hawana income ambayo wanaweza kutegemea. Tuko 600 members.
Mbele ni siku kukaa nyumba kubwa hii kama hii ya 2 bedroom. Niliishi kukaa ronda single room pale ya Praska.
Faida bingu dan sababu
يجيبوا في ربي ما له بلو أدين كده يجفافوا في الدنيا قبل ما حد ربي قبل بكايدور تروب.
Kwa watoto imetunufaisha sana. Ya kwanza hatukuwa na madarasa, tumejengewa madarasa. Kitambo tulikuwa tunahangaika sana. Kwa kunakuwa na mafuriko, classes kunafurika, matope kila mahali. But now tumejengewa classes mpya za kisasa na tunashukuru serikali ya county sana kwa kutujengea.
Mbeleni kama hata alikuwa anakuja late, sasa hii anataka mwisho mapema akuwe mtoto wa kwanza juu kuna vitu ya kuchezea kupenda. Ningemuomba gavana wetu aajiri walimu na ajiri even the mentors, alafu aongezee walimu wengine kwa haya madarasa ndio hawa watoto waweze kupata haya masomo bora.
At the heart of good governance lies active civic engagement. Counties are championing transparency and accountability through civic education and decision making.
Siku za public participation zao wanafanyaga siku za soko ambayo hiyo wakati huo ndio mfanye biashara iko very busy.
But the conversation must not end there. Public participation is not just a constitutional requirement, it's the cornerstone of citizen-driven development. The dialogue between leaders and the people must remain dynamic.
Tulienda huko public participation huko chini, maneno ya devolution. Sisi wananchi tulisikia maneno ni mzuri kwa devolution.
Civic engagement empowers communities to raise their voices, demand services and push for change.
We are here only to seek for justice. We are not here to cause any chaos.
But for that change to last, it must be rooted in social justice. Governments must address systemic inequalities so that everyone has access to resources and opportunities, not just the privileged few, vulnerable, and persons with disabilities.
We have really benefited from the county government. When we need pambas, when we need sanitary pads, they have given us and listening here.
Imetusaidia sana kwa sababu imetusaidia na vitu nyingi. Hadi imetusaidia na wheelchairs, hatukuwa na wheelchairs. Hata shukrani kwenu kunisaidia.
Tunataka serikali ilete training kwa watu, kwa community. Wafunzwe right zetu, wafunzwe ile tunaweza. Sisi ni watu kama wale wengine. Now we have to do anything.
County governments have rolled out social protection initiatives from feeding programs, cash transfers and community support to affirmative action.
Chanjo bado zaendelea. Watoto wa miezi 9 mpaka miaka 14. Chanjo.
Inclusion is no longer a promise, it's a practice, but the work is not done. Counties must engage better at the grassroots, use data to track vulnerability, and implement targeted policies to ensure no one is left behind.
Nafurahia sana kuwa mzazi hapa. Tangu devolution ikuje, nimebenefit sana. Upande wa chakula iko sawa sababu mtoto wangu anakuja ameshiba.
My younger siblings are given 2 eggs, a packet of milk and lunch.
Lishe mashuleni na pesa mashuleni imesaidia watoto kuongezeka.
About the feeding program, it has improved the performance of the learners because the learners...
Financing remains a major challenge for devolution. Counties continue to face delayed disbursements, inadequate funding, and legislative bottlenecks. To unlock progress, national and county governments, the private sector, and development partners must collaborate to finance devolved services. The national government's fiscal discipline, efficient use of resources, and improved local revenue collection. Only then can devolution thrive. Only then will service people hard and duty bearer the realization of equity, inclusion, and social justice for all. This is Kenya's story. A story still being written by 47 counties, by 50 million voices. voices by all of us.
Remarks to this session a bit longer today. We hope to manage time adequately, and therefore the first remarks by the Senate Minority Leader, Senator Justice Retired Stewart Madzayo. To come, the senator for Kilifi to come and make his remarks. Karibu sana, Senator. Let's appreciate Senator Madzayo, the Minority Leader. Karibu sana.
The Right Honorable Prime Minister Bahari Amolo Odinga, the Cabinet Secretary present. I can see my brother Duale, colleagues at the Senate, all protocol observed. Ladies and gentlemen, it is both an honor and privilege to address you today at these critical things and challenges of devolution. I'm truly delighted that the Right Honorable Prime Minister Bahari Amolo Odinga, who is our chief guest today, his presence graces this occasion with immense significance as the undisputed architect and tireless champion of devolution in Kenya. A visionary whose unwavering commitment has laid the foundation for a more inclusive, equitable, and empowered nation. We owe you profound debt of gratitude. Na leo, Baba, nimesikia neno hapa ambalo pia mimi nimekubaliana, ni mkunga wa ugatuzi. Mkunga means wewe ndio uliezaa ugatuzi. Kwa hiyo sisi tunajivunia. It has also been a profound honor to walk this devolution journey since 2013, standing with and serving the people as a whole through every challenge and triumph. Devolution, being the key pillar of our Constitution, has brought governance and equitable distribution of resources closer to the people, and it has enabled communities across the country to participate more directly in shaping their development priorities and assessing essential services. This conference offers a critical opportunity to reflect on the progress made and to explore ways of strengthening and refining our current systems. By bringing it together, policymakers, development partners, and private sector, academia, civil society, and wananchi, we are fostering a collaborative environment where inclusive dialogue can drive actionable solutions. Together, we seek to enhance the effectiveness of devolved governance and ensure it continues to serve as a catalyst for equity, inclusion, and sustainable prosperity. In Kilifi County, we are painfully aware of the socio-economic disparities and the historical marginalization that have stifled our potential, from high rates of teenage pregnancies to limited access to health care in rural wards. These are not just development statistics, they are human rights violations. I'm reminded of the Shakahola massacre that remains a deep stain on Kenya's human rights record, a horrific reminder of what happens when the most basic rights are ignored. It must not be seen as an isolated incident, but as a warning sign of deeper structural and governance gaps. Both nationally and county governments must act decisively, not just to bring justice to the victims, but to ensure that such tragedy never happens again. Subnational governments must also integrate human rights-based approaches to planning, budgeting, and service delivery. That means involving wananchi in decisions that affect them. It means accountability not just upwards to national and county governments, but outward to the people we serve. We cannot go backwards on the aspects of devolution. And whereas I appreciate the stride made by the national government in releasing funds to the counties, delayed disbursements of funds is still a major challenge. And the persistent wrangles between the Senate and the National Assembly only worsens this concern. For devolution to work, we must stop the tug of war played in Parliament and work together for the greater good of the counties. That said, the governors need to be accountable and ensure that each and every monies that the senators fight for is for the benefit of the devolved funds, health, agriculture, water, and other essential services. 12 years since its inception, of the county governments, we stand at a crossroad, a moment not just to reflect, but to re-engineer and take stock of the gains and challenges of devolution. I'm truly delighted that the Right Honorable Prime Minister, Bahari Amolo Odinga, has made his presence here to grace this occasion. Finally, I would like to conclude. For counties to truly become vehicles of equity and inclusion, they must go beyond the service delivery and embed the principles of justice and dignity into every aspect of governance. This requires a shift of mindset, investments in all systems that listen to and work for all people, and the political will to dismantle structural inequalities from the ground upwards. Bahari Amolo Odinga, tunakushukuru sana wewe kwa kuwa mkunga au mwanzilishi wa ugatuzi katika Kenya. Asante sana.
Let's appreciate Minority Leader in the Senate. Asante sana. The next would be remarks by the Senate Majority Leader, Senator Aaron Cheruiyot, and the remarks will be made on his behalf by Senator Professor Margaret Kamar. Let's appreciate Professor Kamar as she comes and delivers this remarks on behalf of the Majority Leader, Senator Aaron Cheruiyot. Karibu, Professor.
Thank you, Governor Sang. Your Excellency, the Right Honorable Prime Minister Raila Amolo Odinga, the father of devolution, as we all know, the chairperson of the Council of Governors, Honorable FCPA Ahmed Abdullahi, the host governor, Honorable Gladys Wanga, the leader of minority who has just spoken, cabinet secretaries led by the Honorable Aden Duale, members of the judiciary who are here, members of the diplomatic corps who are here, members of parliament who are here, development partners, citizens of Kenya, ladies and gentlemen. Mine is going to be a brief one because I'm here, Your Excellency, for two things. One is to give an apology on behalf of the leader of majority, Senator Aaron Cheruiyot, who was supposed to be here but was caught up with some assignment and couldn't come. He gives his apology. Number two, I would like to take the opportunity to introduce very briefly the senators who are here. If you can be upstanding just for 1 minute, I would like to introduce the host, senator who spoke yesterday, Moses Kachwang, the senator of Nandi, Senator Chirarkei, the senator of West Pokot, Senator Murgor, the senator of Elgeyo Marakwet, Senator Gisang, the senator of Tana River, or we call it River Tana, the Mheshimiwa Mungatana, the senator of Nyeri, Senator Wamatinga, the Honorable Senator Hamida, who is nominated, and the Senator Mutinda. Thank you very much. You may take your seats. If I have not seen you, I apologize. If you are a senator sitting somewhere I cannot see. With those remarks, Your Excellency, I will go straight away to read the message that came from the leader of majority from the Senate. It is with profound honor and immense privilege that I join you at this second biannual devolution conference following the transition from the annual devolution conference, and I've given his apology why he's not here. The devolution conference, and this one in particular, serves as a pivotal clamor for reformed constitution frameworks and a transformation of governance structure within the Republic of Kenya. The Constitution 2010, and we are happy that the Honorable Amolo Odinga is here with us, the Right Honorable, Your Excellency, is with us because you are the one who pushed so hard to have the Constitution of Kenya 2010 promulgated in 2010. When the Constitution was promulgated, it made provisions for a devolved system of governance as captured under Chapter 11 of the Constitution, and whose objects and principles are also provided for under Articles 174 and Articles 175 of the Constitution. And the roles are well stipulated between the two levels of government in Schedule 4 of the Constitution. Your Excellency and distinguished participants, it is in the facilitation of the functioning and operations of the devolved governments, the Constitution under Article 203(2) provides for a 15% of the equitable share of the national revenue to be allocated to the county governments. The county governments may also receive additional allocations from the national revenue, either conditionally or unconditionally, under Articles 202(2) of the Constitution. Resources are also provided under Article 204(2) through the Equalization Fund to provide basic services, including water, roads, health facilities, and electricity to marginalized areas to achieve the same level of development as other parts of the country in the principle of equity. The county governments are also empowered under Article 209 of the Constitution to raise their own revenue through what we call the own source revenue, in addition to the equitable revenue that is given by the national government. The Senate diligently fulfills its constitutional obligation of legislation, oversight, and representation concerning the formulation of the pertinent legislation related to revenue sharing, exemplified by the Division of Revenue Act, the County Allocation of Revenue Act, and the County Government's Additional Allocations Act. These legal provisions are paramount for the allocation of resources to devolved governments, which are indispensable for fostering socioeconomic development and throughout the nation. Your Excellency, the devolved system of governance is founded upon the principles of being citizen-centric, rooted in equity, inclusion, and social justice. The execution of devolution is intricately woven into both national and international development frameworks. This alignment is articulated through initiatives such as the bottom-up economic transformation agenda, the Kenya Vision 2030, the East African Community Vision 2060, and the African Union Agenda 2063, and the United Nations 2030 Agenda for Sustainable Development. It is fundamental to appreciate the milestones and achievements that have been realized in various sectors since the implementation of devolution, which has been ongoing in the last almost 12 years. The devolved governments have made significant strides in the development of health facilities, human capital development, development of modern early childhood education centers and vocational training institutions, provision of platforms for public participation, industrial development in processing and value addition, infrastructure development, promoting agricultural production and development of water infrastructure, among others, and we appreciate that from our county executives. From where we sit in the Senate, Your Excellency, the county governments have also made progress in addressing issues of inequalities, marginalization, and inclusion of vulnerable members of society, such as the children, the youth, women, persons living with disabilities, the elderly, through providing opportunities and financial assistance, which are vital attributes to social justice and inclusion. distinguished participants, Your Excellency, it's also imperative to recognize that the devolved system of governance grapples with a plethora of challenges that persist as significant impediments to effective implementation. Among these challenges are, first, the incomplete transfer of devolved functions alongside their corresponding resources. We are very happy that His Excellency the President yesterday did announce the gazettement, which has actually been done, of a good number of the functions that have now been released. And we are very grateful for that. The next agenda would therefore be for the IGTRC to start costing these functions so that they don't just get devolved, but devolution be followed by the resources. There is also the challenge of delayed disbursement of the equitable share between the national government and the county governments. Of course, there is also the challenge of misappropriation of funds by county governments, as we have identified from where we sit. There are leadership disputes also that have culminated in impeachments and the emergence of factions within county leadership, not just in the executive, but also in the county assemblies. In this regard, there is need for appropriate actions to be taken through consultations and cooperation among all relevant stakeholders to provide the much-needed reforms that may assist the devolved governments in the achievements of the objectives of devolution, as well as the fulfillment of the national values and principles and the principles of governance. This takes cognizance of the aspirations of all Kenyans for a government based on the essential values of human rights, equity, freedom, democracy, social justice, and the rule of law as espoused in the preamble of our Constitution. This devolution conference, therefore, Your Excellency, serves as an invaluable platform for introspection and assessment of the feedback regarding both the achievements and deficiencies, allowing for a strategic recalibration aimed at transforming county governments into robust institutions that catalyze socioeconomic advancement within our republic. With those remarks, Your Excellency, I want to thank you and thank all the participants for listening to this message from the Senate. Thank you.
Let's appreciate Professor Kamar again. It's now my pleasure to invite the Cabinet Secretary for Ministry of Health, the one and only Honorable Aden Bare Duale, to come and make his remarks. Karibu sana Waziri. Let's appreciate Waziri as he comes to make his remarks. Karibu.
Your Excellency, the Right Honorable Raila Amolo Odinga, a man who has initiated me into politics in 2005. Your Excellency, the Governor of Homa-Bay, Honorable Gladys Wanga, one of my very, very good legislator when I was the leader of majority, the chair of the Council of Governors, Excellencies Governors, Deputy Governors, colleagues from both the Senate and the National Assembly, colleagues from both levels of government, our development partners, Honorable Excellency, former Prime Minister, as we come to the day 2 of the Devolution Conference, let me first extend my heartfelt appreciation to Homa-Bay County for its warm hospitality, and more so to the Right Honorable Raila Odinga for his enduring leadership in advancing equity and justice. The theme for the people, for posterity, devolution as a catalyst for equity, inclusion, and social justice, reflects devolution as our constitutional and moral compass. It reaffirms our past 2 days as a powerful driver of an inclusive prosperity, tangible equity, and effective governance. Social justice, Honorable Prime Minister, demands that every Kenyan has an equitable access to opportunities. He has equitable access to protections, and he has equitable access to essential services. A goal that devolution advances by bringing government closer to the people, correcting historical imbalances, and ensuring fairness in the distribution of resource allocation. Ladies and gentlemen, Honorable Prime Minister, guided by this principle, our health reform under the universal health coverage focuses on 4 key pillars: human resource for health, making sure equitable deployment of skilled health workers, integrating community health promoters into the formal system, and scaling up specialist training to ensure we have skilled care in every county. And Honorable Prime Minister, as a person who worked with you during the 2010 Constitution, I am still and will always believe that devolution was right, devolution has done the best, and the days when decisions were made for our country from the street of Harambee House or Harambee Street, where you have one side the office of the president, and the other side you have the National Treasury, and all other related offices, including the Judiciary, the Public Service Commission, the Office of the Attorney General, Parliament. I think that is what made us go for devolution. So I still and believe, and that's why I want to confirm that I am one minister who has a very good working relationship, and I want to thank the leadership of the Council of Governors, their CECs, for health, and the entire health team at the counties, that because of my belief in devolution and health is devolved, I work with the Council of Governors and the entire leadership at our counties very well. On health financing, restructuring through social health insurance with the dedicated funds for primary health care, chronic illness, and emergencies, while we are leveraging on public-private partnership to expand our physical space. These health reforms are already delivering tangible gains, reducing maternal mortality, expanding our ICU and HDU capacity along our counties and our referral hospitals, improving our immunization coverage, and enhancing access to oncology, dialysis, and other specialized services. However, challenges remain, including limited physical space, health workforce gaps, emerging health threats, and inequities in access. But these are addressed through devolution, innovation sharing, and collaboration and partnership across our counties. Honorable former Prime Minister and Excellencies Governors, ultimately, social justice in healthcare demands quality care that is accessible, affordable, and dignity. And from Homa-Bay to Turkana, Mandera and Nairobi, it's for this reason that the ministry's reforms and the spirit of devolution reinforces and amplifies each other. Our work is about the people, their dignity, their opportunities, and their future. We have both the responsibility and the means to make social justice a lived reality through a well-governed, well-resourced, people-centered health system. Your Excellency, the Prime Minister, before I conclude, I want to make a confession. Because there are many people here who say the former Prime Minister is the father of devolution. Maybe they have read in the newspapers, maybe they heard through the TV, but I was there on the table when you fought for devolution. As a member of parliament for Langata and as a prime minister. You fought for devolution in Naivasha, in the morning and in the wee hours of the night, navigating the political turmoil of that time. You fought for three things among many things. Three were irreducible minimum for you, because I was a member of ODM, and I'm happy Senator of Siaya and my long-term lawyer who defended me in many petitions, election petitions, is sitting here. And also, the man who first signed my nomination certificate to go to Parliament, Professor Anyang' Nyong'o, is sitting here. You fought for many things, but you had three irreducible minimum. You achieved two. You achieved devolution, and you achieved and you helped us as a community, the Muslim community, the Qadi's court to be entrenched in the Constitution. And I can tell you without fear of contradiction that when history is written, the Muslim community in our country will remember your position. But you fought for also a parliamentary system of government. Kenyans fight every election because of bombers. You wanted to devolve the presidential election through a parliamentary system of government, where one day a son in Turkana or from Kuria will ascend and become the Prime Minister of Kenya. That did not happen. It didn't happen, but at least in everything that you look for, you don't get 100%. We got a good constitution with a very good Bill of Rights. Devolution was key. And just to pick on the region where I come from, former Prime Minister, before devolution, the three districts of Northeastern and the three, which are now the three counties of Garissa, Wajir, and Mandera, used to receive a paltry 1 billion shilling in one financial year for development. Today, because of devolution, Garissa, Wajir, Mandera combined receives close to 30 billion. That is because of what you did as our leader then and our leader now, that you fought for the Bill of Rights that we have today. We fought together with the great minds here, an independent judiciary, an independent parliament. But because this is a devolution conference, I want to thank you on behalf of the people that were with you, some here, some who are not there. the challenges we faced in making sure that devolution was entrenched, that governance was given to the people of Kenya, and the sharing of their resources was given to the people of Kenya. And that is why, again, you have remained consistent and fidelity to devolution. A number of times, colleagues, my former colleagues in Parliament, National Assembly, ask me, why is the former Prime Minister sometimes hard on us when it comes to the Senate? And I want to say it here. The Senate is the custodian of devolution. The former Prime Minister made his time with Professor Nyang' Nyong'o and many people who also became senators. But today, the custodian of devolution is Senate. That is the institution created by the Constitution. And just to conclude, no community, devolution was to make sure every Kenyan, regardless of his community, religion, and his location, are equal before the Constitution and before God. And that is why we want to say, if you want to aspire to be a leader in the Republic of Kenya, you must have certain credentials. You must be ready to speak for the El Molos on the shores of Lake Turkana. You must speak for all religions, and you must speak for all communities. And you must speak for Kenya. You can speak for your community, you can speak for your religion, and you can speak for your region. Kenya is one indivisible nation with one flag, one map, a member of the East African community. And in conclusion, on behalf of the Ministry of Health, I reaffirm our belief together we can ensure devolution truly delivers for the people, for posterity, and for justice. Thank you, God bless you, and God bless the Republic of Kenya.
Another round of applause for Waziri. It's now my honor to invite our gracious host, the Governor for Homa-Bay, Her Excellency Gladys Wanga, to make her remarks, and in turn invite the Chair of COG. Karibu sana.
Asante sana, Governor Sang. Our chief guest today, the Right Honorable the Right Honorable Prime Minister Raila Amolo Odinga, the Chair of the Council of Governors, His Excellency FCPA Ahmed Abdullahi, fellow governors who are present today, the Cabinet Secretary of the Ministry of Health, Minority Leader of the Senate, and members of Parliament present, members of the National Assembly present here today, deputy governors, led by my own deputy governor, who I want to recognize, Yugi Magwanga. Thank you very much. Members of county assemblies and their speakers, led by our speaker there, Polika Pokombo, and the majority leader, Richard Ogindo. Thank you very much. County Executive Committee members, led by the County Executive Committee members of Homa-Bay. If you're anywhere, please rise for recognition. Thank you very much, Dr. Agili and Engineer Munga. Members of constitutional commissions and independent officers, development partners, private sector and academia, The first gentleman of Homa-Bay, Mr. Wanga, please just rise for recognition. Thank you very much for bringing me from the Kano side here to Homa-Bay. Distinguished guests, ladies and gentlemen, Right Honorable Prime Minister, Your Excellency, with your permission, I would like to introduce the local leaders who are present here today, because we are hosting this not just as a county government, but together with our national leaders and members of the County Assembly, and as a region as well. So the local leaders present, please rise for recognition. Our local MPs. I'd like to start with Honorable Millie Mabona, Whip of the National Assembly, Minority Whip, who I think has stepped out, and Honorable Dr. Lillian Gogo, who has also stepped out. Honorable Dr. Ivo Bara, please just wave, Member of Parliament for Kabondo Kasipul. Honorable Martin Owino, Ward Chief, Member of Parliament for Ndiwa. Honorable Dr. Joyce Osogo Bensuda, County MP for Homa-Bay. Honorable Adipo Andrew Okwome, Member of Parliament for Karachuonyo. We have also the Speaker of the County Assembly of Nairobi, who is also a son of the soil here in Homa-Bay. Thank you for rising. Honorable Peter Pondokaluma, our host, Member of Parliament for Homa-Bay Town Constituency. Our Honorable Senator for Homa-Bay County, Senator Moses Kajwang, who is also Chair of the Public Accounts Committee of the Senate. Members of County Assembly of Homa-Bay, if you're here, please rise for recognition. Thank you very much. Those are the honorable members of the County Assembly of Homa-Bay. It is my great honor to welcome you to this second day of the Devolution Conference 2025. I see most of you are in high spirits, a sign that Homa-Bay has warmly embraced you. The pleasant weather, the vibrant ambience, hospitable people, the rich culture, and the delicious cuisine have always been kind to our guests. And I'm confident that you have seen, as our Senator said yesterday, that something good can come from Homa-Bay. The theme of the day is human rights and social justice. I am especially proud to welcome to DevCon 2025 in Homa-Bay my party leader, the Right Honorable Prime Minister, Raila Amolo Odinga, Baba, who has a long track record of fighting for human rights and social justice. He's the father of Katiba 2010 and the father of devolution. His steadfast support and championship of devolution, sometimes even remaining alone in that fight, instills immense confidence in us. It feels as though we are in safe hands, ready to share first-hand accounts of our progress and challenges in his presence. With Baba, we share in the belief that counties should be given more funding. Simply put, funds must follow devolved functions. Upon devolving the functions of health, agriculture, roads, and water, we ought to have seen serious restructuring in line ministries to release funds to devolved units. The sub-theme for Devolution Conference 2025, Re-engineering County Governments to Accelerate Development and Close the Socioeconomic Divide, demands a bold examination of devolution successes and setbacks after 13 years. Many inspiring stories of devolution's impact have been shared across the 47 counties. I want to share on our Homa-Bay's achievements on county functions and impactful devolution stories with our successful programs. Let me start with a story I love to repeat in Homa-Bay, that we are the bay of endless potential, but with limited resources. The vision is an elephant, Kaliech, with resources like a rabbit, Apuoyo. In education, in the last 10 years since devolution, from 2013 to 2022, we had constructed 23 classrooms. In the last 2.5 years, we have been able to build 243 early years classrooms under the Ondoa Kaunda initiative, ensuring that our young children learn in dignified facilities. The hallmark of this initiative is a labor-based approach, giving each of our eye centers 1 million shillings for construction by the local community. Our Fins to Swim scholarship supports 623 bright but needy students, about 40% of whom are girls, through secondary school up to university. The Fundi Mangula program has enrolled 600 youth who have graduated and another 600. Now we are having 1,200 students going through a vocational training scholarship program. We partner with KCB in this program under the KCB to Jiajiri. Some of our Fundi Mangula beneficiaries have been involved in development of projects like the Ondoa Kaunda and the Affordable Housing Project. Our bursary program supports over 20,000 beneficiaries every year, 800 from each of the 40 wards identified through the village cluster public participation framework. In the 3 years of my administration since 2022, we have a cumulative number of 81,860 beneficiaries. In healthcare, we have used our on-source revenue that we grew to a high of 1.729 billion in the financial year 2024-25, using the cashless, fully automated system to fund critical services. At the level 5 Homa-Bay County Teaching and Referral Hospital, we are constructing a 5-story accident and emergency block, which will be complete by December, and a funeral parlor, which is already complete, to give our people a dignified send-off. Our referral hospital features a new outpatient block, an upgraded maternity wing, and other improvements using the resources that we've been able to raise. The Health Facility Improvement Fund has upgraded 70 facilities in various parts of the county, including Rachuanyo East, Sena in Fangano Island, Your Excellency, which you came and opened with us in Soklo up there, Pala, the Tomboya Health Facility in Bita, and among others. On wellness and climate change interventions, we have set up green spaces, including the Governor's Park and the Arboretum, which you have just visited this afternoon, and the sports programs, including the Genoa Governor's Cup every year, and partnership with the Akakoro Football Academy, who are setting up a modern academy in Diwa. On trade and markets, for our community empowerment through the Inua Boda Boda initiative, each of our 40 Boda Boda circles across the 40 wards received 1 million shillings on grant to be able to empower them, to be able to get them to get their own motorbikes instead of riding on behalf of others. In efforts to bolster commerce and give dignity to our traders, modern markets are currently under construction in Rodikopany and Kendube, Misambi, as well as Sindo, Luanda, and Diwa. Projects that are delivering transformative economic spaces. On county roads, we continue to invest in accessibility and mobility, opening up 518 kilometers of new roads, rehabilitating 319 kilometers, maintaining 551 kilometers, and reconstructing and maintaining over 6,000 culverts, which offer critical lifelines that connect our markets, sports grounds, and communities, ensuring cohesion and opportunity across every ward. In agriculture, we have transformed Homa-Bay into an agricultural producer county. We have harnessed our agricultural potential with projects and investments, and the results are promising. We lead in national production of several value chains. We are #1 producers of sweet potatoes, #2 producers of cotton, only #2 to Lamu, #1 producers of groundnuts, #1 producers of sunflower, #1 producers of soya beans, #3 producers of millet, and #17 producer of coffee in the country. We are now growing coffee in Homa-Bay. Mbesha is coming to our farmers for them to uplift their livelihoods. My passion in agricultural productivity, the intersection of food security, agro-processing, trade, job creation, and enhanced farmers' incomes, leading to tremendous economic growth to deliver Homa-Bay City in a decade. Full devolution with attendant funding will give good national economic outcomes in the 47 counties. In the next national planning cycle, like Vision 2030, devolution should be a key pillar. We commend the current administration for allocating 415 billion to counties, although, Your Excellency, you had said we should get to at least 450 billion. And the council had said at least 530 billion. So we are at 415 and we appreciate, but we hope that we can get to even higher amounts. Your Excellency, to promote inclusion, 2 days ahead of the Devolution conference, we ran a hackathon competition which brought young people from all 47 counties, and they were called ethical hackers. They were coding, and the title of that was Hacking 48 Governments in 48 Hours. We saw impressive solutions on effective public participation, health diagnostics, and managing road accidents through monitoring speed. In technology, we will involve the youth and get their innovation on board. As I conclude, Your Excellency, Prime Minister, allow me to once again really thank my colleague governors, led by the Chair of the Council of Governors, for accepting that Homa-Bay would be the host of this year's Devolution Conference. It looked like a pipe dream when we began to discuss it with Senator Kajwang when we were just elected. But we are very, very glad that colleague governors accepted that this small county, sometimes considered on the very far end of the world, be able to host this conference. I'd like to thank the chair of the steering committee, Governor Mutahi Kahiga, who has made several trips to Homa-Bay in the process of planning. I'd like to thank the COG Secretariat team, led by the CEO, Madam Mary Mwiti, and the entire Secretariat. They have made trips here, they have spent sleepless nights. I know that seeing that this conference has become such a huge success gives you great satisfaction. I'd also like to thank very much my team, the county team that worked together with the COG team to deliver on this conference. Finally, I look forward to hosting you tonight to a sumptuous dinner at the Governor's Park. Tafadhali, this evening, there's dinner and ohangla at the Governor's Park. Please do not miss to attend the dinner this evening. Erokamana hinya, God bless you, and welcome once again to Homa-Bay County. Let me take this opportunity to welcome to the stage the indomitable chair of the Council of Governors, the Governor of Wajir County, the land of camels, Governor FCPA Ahmed Abdullahi. Tafadhali tumpigie makofi our chairman as he comes to deliver his address.
Very good. Thank you very much, Your Excellency, Governor Gladys Wanga. Our chief guest for the day, the Right Honorable Raila Amolo Odinga, Prime Minister, Excellency Governors and Deputy Governors who are here, the Cabinet Secretary for Health, the Honorable Aden Duale, Senators, Honorable Members of the National Assembly, representatives of the Judiciary, leaders of Homa-Bay County and the Greater Nyanza region, Excellency Ambassadors and High Commissioners, Principal Secretaries, Speakers and members of the county assemblies, all national and county government representatives, private sector, civil society representatives, development partners, international delegates, all delegates, ladies and gentlemen, hamjambo. Good afternoon. Your Excellency, the Right Honorable Prime Minister, let me take a few minutes, first of all, to introduce the governors who are here, who will not have an opportunity to come and say something at the podium. All Excellency Governors, please. We have the host Governor, Gladys Wanga. We have my Vice Chair, I think, who is outside. We're expecting the Prime Cabinet Secretary to be here any time. He's probably waiting to receive him. He's gone out with Gladys. And then we have our whip of the Council of Governors. Your Excellency, the Council of Governors has 3 executive committee members who run the affairs of the Secretariat together with the Secretariat. And it's the chair, the vice chair, and the whip is Governor Stephen Sang of Nandi. We have Governor Muthomi Njuki, who is our chair of the Health Committee of the Council of Governors. We have Governor Cecily Mbarire, Governor of Embu County. She chairs resource mobilization for us. We have our Chair of Agriculture,